I'm going to demonstrate how to insert a Foley catheter into a female patient. First of all, you want to remember to have your supplies handy. Well, first thing we're going to do is wash the perineal area, and so you want to have your tub of hot soapy water. You want to make sure that we use only soap and water when we wash the perineal area, and especially after we have a Foley catheter in. I'm going to have my Foley catheter kit ready to go. I want to have 2 pairs of clean gloves. I want to have a piece of tape ready in case I need to secure the catheter, in case it doesn't have a safety secure inside. I want to make sure that I have a graduated cylinder and a paper towel to put it on when I go to empty the Foley bag. Okay, so the first thing I'm going to do, I also want to make sure that my patient is positioned for comfort, not so much privacy, because this is not a very modest procedure, so the patient won't be very covered, but you have to have a good surface to work with. And I'm going to make sure that my bed is high enough so that when I do open my Foley catheter, this will be a sterile area. And so I do need to have it at waist height. Okay? So the first thing I'm going to do is make sure I have my warm soapy water, and I'm going to clean the perineal area. So I'm going to use as many washcloths as it takes, and I'm going to go ahead and make my mitt. And when I'm cleaning the perineal area, of course, make sure you tell your patient that you'll be touching their private areas. And I'm going to spread the patient's labia, and I'm going to make sure that I clean the labia minora inside closest to the urethral opening. And I want to make sure I clean real well. And then I can rinse out my washcloth and make another mitt. And I'm going to clean from the distal side, the proximal side, and then down the middle. And I want to remember my concepts of clean to dirty and also anterior to posterior. Okay, so once that is real clean, that area, I'm going to come with my towel, and I'm going to go ahead and dry. Okay, and then I'm going to remove my towel, and I want to make sure I have a waterproof pad underneath my patient. Okay, now at this point, I'm going to take off my clean gloves because I'm going to be ready to open up my sterile field. All right, I have my Foley kit in hand. I want to make sure that it's not been opened, it's not been torn or wet, it's intact, and that the expiration date or the manufacturer's date is within, that it's recent. Okay, and this particular Foley opens kind of like an envelope. I'm going to open my kit, and I can touch the outside of this because the sterile part is on the inside. All right, so I can touch this part right here. I'm going to position this and give myself plenty of room on the bed. Make sure I tell my patients I'm about to open a sterile field and they need to stay real still for me. Okay, following the concept of distal, I'm going to open the distal side first. Okay, out to the side. Out to the side. And make sure that you make your paper mind you when you're opening up this field. Okay, I want to stay, I don't want to cross over my field, yet I want to make sure the edges fall flat and it doesn't fall back on itself. Okay, and then the proximal side. Now my field is open, and I want to position this field up a little closer to my patient. And as long as I don't reach over my field at any point, I can move it up using the 1-inch border. Okay, and now it's closer to my patient. Now if you notice that part of the patient's leg has gone over the sterile field on that side, and that's perfectly all right. You just have to understand that now your sterile border has come more in on your field, and you just need to stay away from that area. Okay, so that now that my field is positioned, I need to reach in and get my sterile gloves, which are on the top of my sterile field. Okay, and I can do that. I didn't touch anything else. I can reach in and take that right off of there. All right, now remember my sterile field is over here in my periphery and I can still see it. I'm about to open up another sterile field up here on my table. And of course my table has already been cleaned as well as the edges. And now I'm going to open up these gloves. Okay, and remembering how we put on gloves, I'm stepping back away from my field, putting my gloves on. And in this case, my gloves were in backwards, but I was able to put them on by moving my hand around inside the glove. Okay, I can put one finger here, stepping back, up and away. These were as well backwards, but that's all right because We can fix that. Okay, now I have my sterile gloves. This is no longer a sterile field, so I can turn my back on this because now I'm going to be over my sterile field right here. Now I have 2 sterile hands. I can reach inside of my sterile field, move my box up, my kit up, maintaining a 1-inch border around my field. I can move my tray out. I can remove this drape, which is a fenestrated drape, and we'll use that when we demonstrate the male catheter. Now I have a tray here that we sometimes call our toy box, and the goal is to remove everything out of our toy box, and then we know we're ready to go. This Foley catheter kit has some extra things that we won't be using. I'll show you that when we get there. Okay, the first thing I want to do is provide a nice safe place for my Foley catheter to land when I uncover it from its plastic tube. So this is lubricant. I've opened my lubricant, created a nice little hole for my lubricant to go in. The next thing I want to do is open up my sterile swab sticks. Now, if you notice in this catheter, you see some cotton balls and you see some forceps, and sometimes we will put betadine over them and use the cotton balls, but in this case we're going to use these sterile swab sticks because, for one thing, we can touch the mannequins with them. All right, so I'm going to take these and get them ready to go. Pull them out of their packet so I can grab them pretty easily. All right, I'm going to uncover my catheter and see how it's doubly wrapped to keep it nice and sterile. As I curl the catheter around my fingers, I want to scoop up this plastic sheath with my other hand. Get rid of that. And now I'm going to go ahead and put my catheter in its little house. And I want to keep it protected. All right, you're also going to have some sterile water. And we need to blow up our balloon at the end of the catheter with that. So I'm going to hook that to its port. I'm also going to take out my specimen cup. And I'm going to set it aside. All right. The only thing that needs to be sterile in that specimen cup is the inside and the cap, so it can sit over there. Okay, at this point, I'm ready to start cleaning my patient. And what I need to tell my patient is I'm about to touch the private areas, and I'm going to use some cold solution. And it may be cold and it may feel like it's dripping down, but we have to clean, and we're going to clean the same way that we clean the perineal area with soap and water. We're going to use the concepts of clean to dirty, distal to proximal, and anterior posterior. So I'm going to contaminate this non-dominant hand now and tell my patient I'm going to touch them. I'm going to open up the labia, and where I want to clean with the swab stick is inside the labia minora next to the urethral opening. Okay, and I'm going to clean from distal to proximal and anterior to posterior, one swipe, to come across the patient, and I'm going to throw this away. Let me show you what you don't want to do. You don't want to come down and come across your sterile field because the swab stick is contaminated. So one swipe, and I'm going to throw it away. I don't want to let my fingers go because if the labia close, then we have to start again. Okay, now I'm going to go proximal inside the labia minora, anterior to posterior, away from my sterile field, down the center, and away from my sterile field, and in the trash. Okay? Now I'm ready to insert my catheter. I'm going to tell my patient, go ahead and take a deep breath. I'm going to insert the catheter. Now in a female patient, I'm going to insert this catheter into the urethral opening about 2 to 3 inches or until I see urine. Okay, let's say I see urine, and I'm going to go another inch. Okay, as I'm feeding the catheter into the urethral opening, I don't want the sterile hand to touch the patient. Okay, I see urine, I've gone another inch. I'm going to let go. With my non-dominant hand, reach underneath my sterile hand so that I do not contaminate. And I'm going to inflate my balloon. I need to leave my thumb on the syringe because if I let go because of the pressure in the bladder, it will come right back out, the water will. I'm going to give a little gentle tug. I'm inside of the bladder, let go, and then I'm going to disconnect. Now, At this time, I have betadine and I have lubricant all over my hands, and I don't want to touch any of this catheter or anything here. So at this time what I'm going to do is I'm going to change gloves. Okay, so I've taken off my sterile gloves because they had betadine and lubricant on them, and I put on a pair of clean gloves because now what I need to do is pull out this bag, the Foley catheter bag, and I'm going to go ahead. I want a nice straight drainage. Okay, so I'm going to kind of straighten out. You know how you do with Christmas ribbon, except you do it backwards. You want to kind of get this straight, and I want to hang this catheter now onto the side of the bed, and I want to hang it on the side of the bed that goes up and down with the patient. So I don't want to put it on the rail. I want to put it on the bed frame itself. Okay, so I'm going to come over here and find a nice spot to put it on the bed frame itself. And now I need to go ahead and tape, and that's why you pulled a piece of tape. I need to tape this catheter to the patient's leg so that it doesn't pull. An important part of taping this catheter is making sure that we put it around the catheter itself, and then we put it on the patient's leg. Because if you put the catheter straight on the patient's leg and tape it, you're going to cause some skin breakdown. All right, so I've actually taped it around. See how it's nice and loose? It's actually just taped around itself and then taped it on the patient. Okay, so now I have some nice straight drainage of urine. I'm going to notice the color. I'm going to notice the clarity of the urine. Okay, and we'll save that for documentation purposes. Your physician is probably going to order a urine specimen as soon as we put this catheter in, because we're going to want sterile urine. So at this time, I'm going to show you how to collect that urine specimen. And you're going to need to kink your tubing, and down here on the tubing bag, and this isn't what it's for, but this works really well, is a little rubber band and a little clip. And what this is really for actually is you can attach this to the sheet, and therefore your tubing won't go too far. But what we use it for that works real well is if you come on up here, and you want to be up as close as possible to where you can see the urine collect, and also if this has got some silver lining or antimicrobial solution in it, in the catheter itself, it could alter the effect of the specimen. You're going to want to go ahead, and if I just clamp it and put this little clampy guy over it, then I can collect some urine right up in here. Okay, and this is where I need to collect my specimen from. And each catheter will be a little bit different, but you'll have a port. If you can see this port, okay, and what we're going to use is actually a syringe, and your facilities will have different ways to collect sterile specimens. This one actually, you can actually put a little container on here that actually screws on. It's a needleless system, and what we'll do is we'll take an alcohol prep, wipe this off, and go ahead and collect our sterile specimen. After it collects here in the tubing, okay, I have a sterile specimen now, okay, and I'll come over here to my specimen container. Remember that the inside and the top of the cap are sterile, so I will put this upside down, put my urine in, pick up my cap, okay, and there's my specimen. Always remember to come back and unclamp your tubing on your patient, because you don't want that urine to go back up into the bladder. And that concludes how we put in a Foley catheter, how we collect a specimen, and how we hang the bag.